Hello, everyone. I'm Marcus Robertson with Becker's Healthcare. Thank you for tuning in today to the Becker's Healthcare podcast series. We are thrilled to be joined by Kate Leatherby, Regional Vice President for the U.S. West at Pulsara. Kate, thank you so much for joining us today.
Thank you so much for having me, Marcus.
Let's go ahead and jump right into our conversation then. When Pulsara starts working with a new health system, what types of challenges typically are they looking to solve?
So typically when health systems approach us, they're looking to overcome challenges with fragmented communication. Indicators of that are usually, they're looking to decrease time to treatment for time-sensitive emergencies. We have some great data surrounding that. Our customers typically see about a 30% time and decrease of treatment for time-sensitive emergencies across the board, across our customer base. There's also other reasons they look at the platform, such as scaling up communication in the context of MCI. Recently, the pandemic is, I think, still fresh in everybody's minds. So load balancing and patient logistics, movement, those types of things to get patients to the right resources at the right time.
Okay. So you said mostly, to overcome fragmented communications and kind of lay that groundwork for better infrastructure for the future.
Yeah, that's exactly right.
So with that in mind, how does Pulsara fit into that health system's current workflows? Do organizations need to purchase new hardware in order to use your platform?
And so that's a great question. Current workflows, we integrate really well into current workflows. So taking the process that they're currently using for activating time-sensitive emergencies, STEMI, stroke, trauma, and just kind of overlaying Pulsara into that. But we stand out as being not just another thing. I like to always caution people, we're not another thing. We're improving upon existing systems that are in place. So, what we do, we create transparency in communication. Like you said, we lay that groundwork, that communication infrastructure. And so it's an opportunity to improve upon current process. So, we can overlay our technology and just replace the, phone calls, radio reports, those types of things. But I think it's also a great time for our customers to evaluate current process and look for ways to optimize what they're already doing. Just to add to that, as far as hardware, because you did ask about hardware and I realized I didn't address that, but there is no on-site servers that are required. We're a cloud-based application. We work on Android and iOS mobile devices, as well as we have a browser version for those folks in the hospital that are seated at a computer more often than not. So no hardware needs to be installed at the hospital.
And this is, again, you said an improvement upon your existing systems, not just, another thing to add in. And so can you think of any particularly innovative ways you've seen some of your seasoned customers leverage that platform?
Yeah, I love this question. The most satisfying aspect of the work that I do is having a front row seat to, really the amazing and innovative work that our customers are doing. I talked about time-sensitive emergencies and then using the Pulsara platform in the context of something like a pandemic, a mass casualty incident or something like that for patient logistics and movement. But our customers get a hold of this technology. They start optimizing their workflows. They're seeing improvement in the way they communicate. They're seeing increased satisfaction because there's less communication errors. We know that is a big thing that comes up whenever we have sentinel events. Communication is always an area where we can improve. So our customers really take the platform and kind of run with it. Some of our customers they're building stroke systems of care. So they're really enhancing how they're delivering stroke care to patients in their region by, if a patient can stay at a local hospital and receive a scan and TPA really quickly, they're using the Pulsara platform, the video aspect of our platform, to be able to connect with a comprehensive center, a stroke teleneurologist, and be able to better triage that patient to the appropriate place. There's some really great initiatives. I live in the state of Colorado, and so there's some really great telehealth and telebehavioral health initiatives going on here in the state with Pulsara. I'm looking to overcome things like rural disparities, increasing access to care for our mountainous and frontier rural areas of the state. They're also streamlining the referral process for behavioral health needs, so decreasing time to referral. And as I said, increasing access to care in rural areas, that's a big one for many states. live video consults from hospital to the field for our pre-hospital care providers, better being able to serve those patients and allow their medical directors to have some transparency, getting eyes on those patients to see, what their needs are and better be able to direct the paramedics in the field. And then, I talked about the MCI and incident management stuff. We're starting to see customers incorporate Pulsara into emergency operations plans as the communication piece of it. And use Pulsara for logistics and patient tracking, to meet needs, like I said, and something like the pandemic. So they have that communication infrastructure in place, and they're really easily able to take care of the everyday patient, scale it up if they need to for surge events, or work on some really great initiatives in their communities, increasing access to care.
So with as thrilling as, improvements in that communication infrastructure is, at the end of the day, this is all about improving patient care ultimately. So how does Pulsara's platform do that? Are you speeding, the patient's actual time to treatment? How are you improving that patient care?
Yeah, that's, really what we aim to do. Many of us that work at Pulsara we used to be patient care providers in a previous world. I was a paramedic for a long time. And so really the patient is at the forefront of our minds all the time. So across the board, as I mentioned, we're seeing about a 30% reduction in time to treatment for time-sensitive emergencies. And they're doing that by streamlining communication. And really that amount of time can be life-changing. When we're talking about stroke, stroke, brain is time is brain, and the setting of STEMI, time is muscle. And trauma, they really, try to work within that golden hour. So minutes count. And I think a great example that we have of quantifying the amount of time it takes to get a page out to trauma, STEMI, or stroke. So think about that process. If we have a patient coming from the field, they're notifying the hospital. Somebody's taking that report from the phone or radio. They're then calling a central paging service who's paging out that team. The team has to receive the page, call back to central paging, and they call back to the ED to let them know the team has received that alert. So, thinking about that process, and when I talk to people that are evaluating Pulsara, it's, that you don't realize when you're in the weeds, or you're sitting right there, that process can take, our customers report to us about 5 to 7 minutes. They're seeing just in that piece of communication a 5 to 7 minute time saving. So like I said, that is really important to, especially those time sensitive patients where every minute, every second counts.
Yeah, no, 5 to 7 minutes is an absolute, literally can be a lifetime of difference.
Yeah.
And you said you were a paramedic yourself. It is really sounding like EMS plays a huge role in decreasing these overall treatment times. The relationships between pre-hospital and the hospital teams, how have you seen those relationships change as they are using Pulsara?
Yeah, that's a great question. At wearing my paramedic hat, it's just, we've always wanted to be integrated really into the larger care team. So, EMS is so important to the chain of survival. And with Pulsara's technology, you have the ability, like I said, we really just want to be integrated into that larger care team, and you have the ability to, via, team communication, to integrate them into that larger team, creating transparency amongst the team members and that continuum of care. The other thing that I really love about Pulsara, something that was super important to me as a paramedic, was getting feedback on my patients. You care about your patients. It's not something that you just drop them off at the hospital and you're like, okay, I hope they do well. It's you care, and you want to know that they were treated well and that they had a good outcome. So one of the features in Pulsara that's great for pre-hospital, essentially outreach, is to close that loop of communication. When you close a Pulsara communication channel, EMS is getting real-time feedback. And so that closed loop communication, it kind of closes that emotional loop as well. And it's extremely important to caregivers and enhancing that overall team relationship between hospital and the pre-hospital worlds.
Yeah, if you get into this field, you're doing it generally, I think, to help people. And so knowing that person that you're helping ended up, getting what they needed, yeah, that seems like that can be huge for,
Yeah.
emotional and mental health for, EMS workers.
Oh, sure. It definitely wears on your mind. You think about them long after they arrive at the hospital. So it's a really important thing.
I can only imagine. And on that note, EMS, of course, was, in many places, unfortunately, a bottleneck during the really big COVID surges. How did your customers leverage Pulsara's platform in those times? What did they learn for the future?
Yeah, so our customers, I was just so impressed. They did a beautiful job of pivoting to meet the needs of the patient population during COVID. And, we saw examples of that on the news, all the wonderful things that the people were just doing in general in healthcare, working long hours and putting themselves at risk. Our customers, I was so excited to see what they did with the platform in that setting, because as I mentioned before, they're always finding creative ways to integrate Pulsara into what they're already doing and improve upon existing process. So the need during that time, the big challenge was really patient logistics and load balancing. So, the EDs were packed full of people. We're trying to get treatment to people that, you mentioned a bottleneck. So how do you do that in that setting? So we started to see customers using our live video functionality in the platform to do things like preserve PPE, being able to send one provider in with a patient and have that provider don PPE and not send in other people to preserve that PPE. And then in the field to mitigate surge. You talked about the bottleneck again. So we wanted to mitigate surge. We wanted to keep patients at home that could stay at home or get those patients to the right care, not necessarily the emergency department. So what we saw EMS doing telehealth consults with their physicians and connecting patients in the field directly with a physician via live video. And as a paramedic, I can, recommend to somebody, we think you're okay to stay home and follow up with your physician, but it's always really comforting, I think, for patients when they can connect directly with a physician. There's nothing that can really take the place of that. So that was really nice to be able to bring the physician right to their own home and allow them to stay in the comfort of their home versus going to the emergency department and sitting there for hours. We also saw customers setting up on a larger scale virtual transfer centers, regional and state level transfer centers to load balance those patients. So, the difficulty was resources throughout the pandemic. So getting those patients to beds in hospitals where there were beds available and being able to communicate that and facilitate that interaction through Pulsara, it was really, really efficient. And so that infrastructure in those areas where they did that still exists today. So they're really set up if something else happens where there's an incident that exceeds their capabilities and resources, they have that infrastructure set up and for the future. So it's really cool to see that is now part of a plan. Nobody ever thinks that something like the pandemic will happen. It's out of sight, out of mind until it actually happens, and it did happen. And so it's nice to see that people are continuing to keep existing structures that they had in place. So if something like that happens again, they're set up for success.
Yes, and of course, we all hope that something like that doesn't happen again, at least anytime soon. Very much, over the pandemic restrictions and everything. But
yes, we all are for sure.
Well, Kate, I want to thank you for your time and all your insights you provided. Also want to thank Pulsara, of course, for sponsoring our podcast today. And our listeners, you can be sure to tune into other podcasts at beckershealthcare.com/podcast.